What if you're able to take that camera and do imaging in the back of the eye and have artificial intelligence? And what's super exciting, and I know you all at UCSF are always at the bleeding edge of innovation, and you're now able to look at someone's retina. And because the retina is actually brain tissue and the only vascular bed that you can look at non-invasively, you can now predict heart attack, stroke, Alzheimer's. So the eye is not just the window to the soul, it's the window to your full body exam. And I don't think we're too far off where in 5 or 10 years, you're going to go to your ophthalmologist and they're going to tell you more about your heart than your cardiologist.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
Every day, in many communities without enough resources, millions suffer from blindness that could be prevented. A lack of proper eye care, old training methods, and few modern tools leave many in the dark. In places where a simple cataract surgery could bring back both sight and hope, big challenges and a shortage of new ideas block the way. Inspired by these problems, an amazing journey spans continents and changes lives. Born in a small town in Virginia, Dr. Hunter Cherwek, Vice President, Clinical Services and Technologies at Orbis International, took a path from the halls of Duke and Emory University to a remote part of the world. That began as a simple interest in medicine grew into a strong promise to end preventable blindness. A life-changing experience in Kenya set him on a course that reshaped his mission in eye care and pushed him to find better solutions for communities in need. Dr. Cherwek is a well-known eye doctor, and he's also a visionary who mixes the latest technology with a deep passion for teaching. His work at Orbis International, especially on the famous Flying Eye Hospital, has helped perform surgeries that restore sight in over 20 countries. He also created a prize-winning online learning and remote care program that supports health workers around the world. His 6 years as medical director of strategic markets in Beijing show his steady drive to change old ways and bring better eye care all over the world. In this episode, Dr. Cherwek explains how a lucky scholarship and early global experiences shape his promise to end preventable blindness, the challenges of providing modern eye care in low-resource areas, and how using tools like remote care and training simulations can change how we teach and treat patients. Here's our conversation. Welcome, Hunter. Thanks for joining me today.
Oh, well, thanks for inviting me. This is already going to be a great day.
Yeah, so today is a very rainy day in San Francisco, but we definitely need the rain. So I always like to ask our question first is about your journey. What takes you to where you are today? What inspires you to do what you're doing today?
Yeah, so I grew up in a very small town in Virginia. I went to med school and I thought I was going to be an orthopedic surgeon of all things. But I was very lucky in that in my undergrad, I got a scholarship to go and work in Kenya for a summer and work with the Flying Doctors of East Africa. I was doing immunizations and doing maternal fetal health, which has absolutely nothing to do with ophthalmology. But I was just so enamored and met some amazing mentors early in my career in global health. So I went into med school thinking global health. I loved surgery. I loved orthopedics at the time, especially hand surgery. And then I went back and saw ophthalmology and fell in love. And the miracle of giving someone their sight back and the impact that has in low to middle income countries, that stuck with me. And so the rest is history, as they say.
Yeah. And it's interesting. When I think about orthopedic surgery, it's like something that's so carpentry, right? That's what everybody say. And then the ophthalmology is something so different. But I guess you never really went to orthopedic route yet.
Well, I did do a lot of orthopedics. And I think every time people hear ortho, they think of, a bigger hammer, a bigger chisel. But hand surgery, which was what I really loved, they use microscopes. They do amazing reattachment surgeries and very delicate surgery. And, just like giving someone their sight back, giving someone the function of their hands is just incredible. So I really, I know ortho gets sometimes a bad rap, but I loved it. And even to this day, I talk to my friends who are hand surgeons, and I'm a little jealous of what they get to do, to be quite honest with you.
So you mentioned that you were immersed in the global health side of things. And what are the things that you see in the global scale, the challenges in the eye care?
Yeah, I mean, what I would say first and foremost is I meet some of the most amazing people. The professors, the surgeons, the patients, their families. Every person who comes on the Orbis Flying Eye Hospital has an incredible story behind them. I think what's interesting from a physician standpoint, that's from a human standpoint. As a physician, there are diseases that I see that we don't have here in the United States, like rubella cataracts or trachoma, which is an infectious cause of blindness, but also the severity of disease, the pathology, where we address cataracts early here in the United States, whereas in other countries we may see that they have incredibly dense and complicated cataracts or pediatric cataracts or genetic diseases that we don't necessarily see that frequently, here in the U.S. When I first went to Ethiopia, I saw rubella cataracts for the first time, and I saw 7 kids with it. And my entire residency, I did not see a single case. So, I would say for all your listeners, I mean, global health is a great way to reconnect why you went into medicine. You'll meet amazing people. You'll see innovations and things that you don't even hear about here in the US. And you'll see diseases or pathologies that really are so amazing that I still go to work and I feel like I'm an intern again, still excited to answer my page and run down to the ER. It really is an amazing career that I've been able to have with Orbis and in global ophthalmology.
And when you say something that you've never seen before, and in the US, so a lot of your counterpart who are US physician would not be your advisor in that space because they've never seen that before. How do you go about that?
Well, I love what you just said, and that's where I started by saying some of the best surgeons and the best professors and mentors I've had have not been in the U.S., and some of the best cataract surgeons are not in the U.S. And so, for example, the disease that's an infectious cause of blindness called trachoma, we really don't see that in the U.S. It was out of Ireland in the 50s, but I speak to my doctors there who see it every day, and the new innovations and the new treatments they have for treating the eyelid disease and how they're treating that, to me, is exciting. So for me, getting to learn all the different diseases, the pathologies, but then also how the experts and the key opinion leaders in those countries are dealing with those diseases, that's why I love Orbis. Not only am I constantly teaching, I'm also constantly learning.
You mentioned that some of the disease that happen overseas that's not in the US. Do you think it's because we have a better eye care, or is just that it's a different genetic makeup of the population? Do you think some of the disease can come to the US?
Yeah, so all great questions. And I would say that certainly the most common causes of blindness are common here, but also common in parts of sub-Saharan Africa or Southeast Asia. So, for example, cataracts or glaucoma. The one that's really exploding is diabetic retinopathy, where a lot of communities that didn't have diabetes 50 years ago, it's now becoming one of the top leading causes of blindness. Also, as people are living longer, diseases like macular degeneration are becoming more and more common. So I definitely think there's demographic, and commonalities no matter where you are in the world. But for example, the river blindness, we don't have river blindness in the United States, right? We don't have the trachoma that they have in Ethiopia. We have 73 full-time employees at Orbis in Ethiopia every day distributing the Zithromax, azithromycin drug to get rid of the bacteria that's causing this blindness. It's my goal, if I live another 15 years, that I will get to see the last case of trachomatous blindness, which is amazing. This is a disease that's been around for thousands of years. People don't know this, and I think, especially how innovative UCSF is in Silicon Valley and that community in Northern California. Out of all the fields of medicine, do you know which one was the first to have gene therapy approved by FDA? Ophthalmology. Do you know which was the first to have FDA approval for autonomous artificial intelligence where the patients are being diagnosed without a human being? Which field? Ophthalmology. And Orbis is taking those technologies, to low to middle income countries. We've done clinical trials in Rwanda looking at artificial intelligence, and that's our in-house AI. So Orbis is a aviation company, a software company, an AI company. I love it because I get to work with the smartest people around the world, not just in medicine, but in technology. And some of the people that have really impacted my career are the mentors and professors I've met around the world. And they've taught me how to treat diseases and diagnose things that I was never taught in my residency. So it's like I said, I always call the Flying Eye Hospital really the Flying Eye University. And every place we go, it's a skills exchange program. I learn how they do this. I show them how we do that. I love that collaboration. To me, the Flying Eye Hospital is the world's best example of functional diplomacy.
Well, I can hear from your voice how excited you are working in Orbis. And so maybe this is a good time for us to hear more, like what does Orbis do, why they do, what's the mission, because I think it's really exciting for everybody to hear.
Yeah, so if you're interested, you can go to orbis.org. So Orbis is a global nonprofit, and we're exclusively focused on blindness. And what most people don't know is the vast majority of blindness is preventable or treatable. 90% of it is in low to middle income countries, and a disproportionate number of women and girls are affected. And one of the things I will tell you is blindness, as we're showing in our research, and we've done some great research that's been published in Nature and Lancet Global Health, is how important sight is to emotional health, education, and economics. And you can do a cataract surgery without electricity. So we literally are able to do surgeries in the most rural places. And the next day, the patient goes from visually impaired to seeing better than I do without my glasses. So for me, the miracle of sight, the innovations in ophthalmology are incredible. So Orbis started in 1982. We took a eye hospital, put it on board a DC-8 aircraft, and started going around the world holding conferences, skills exchange programs, and treating patients on board a U.S. hospital, accredited hospital, on a plane. We've been to over 95 countries, but really what's exciting is how over the past 2 to 3 decades, we've expanded. So it's not just the plane. The plane is only about 15% of our budget. We have permanent offices in multiple countries, whether it's Ethiopia or Bangladesh or China or India. What really is exciting is also what we're doing in the tech space. We've partnered with for-profit companies and created surgical simulators using gaming hardware and the Meta Oculus headsets, and are now training surgeons in Bangladesh, Mongolia, India, China, and Ethiopia with gaming hardware that's 1/30th the cost of commercial surgical simulators. We have telemedicine that's managed 40,000 patients around the world for free with experts around the world. So for me, what I love about Orbis is we're exclusively focused in one disease, blindness. We look at technology and training to build capacity in the communities that need it most. And we're really breaking that vicious cycle of poverty and blindness in literally 5-minute, 10-minute surgeries. So it's a really exciting field. Obviously, I've been doing this. I finished my residency in 2005. I turned in my pager when that was a thing. And 4 hours later, I was on a flight to Western China to join the Flying Eye Hospital. And I can tell you, working in global ophthalmology, I've not regretted a single day. Even when they lose my luggage and I've missed my connection and the hot water heater is not working at the hotel, I am still probably the luckiest person I know in medicine.
Yeah, it sounds like you have quite an adventure as well. You mentioned about training the surgeon on site, and is that the goal is so that all this country would have enough clinician to take care of their population? Is that what Orbis is doing?
Absolutely. I mean, in some countries like Ethiopia, there's one ophthalmologist per million population, and most of them are concentrated in the major cities, and the blindness is actually in the rural communities. And at Orbis, one of the things I love is, while certainly surgeons and doctors are important, we train nurses, anesthesiologists, biomedical engineers. We even teach school teachers how to identify eye diseases on the first day of class. So for me, just like it takes a village to raise a child, it takes a village to restore a child's vision, right? And so we use every single member of the community to go from finding a child in a rural village to bringing them to a vision center, whether they need glasses or surgery. We're able to do that through telemedicine and artificial intelligence, and then bringing them to a center where there is not just a surgeon, but a pediatric anesthesiologist. Don't forget, these children have to be put to sleep to do their surgery. An orthoptist, a social worker, a nurse. I mean, I'm always in awe of how many people have been impacted by Orbis. And I will land the Orbis plane, and the chair of the department will be, I was a med student 30 years ago when Orbis was here, and you inspired me to go into ophthalmology. And the nurses will come on board and say, I started becoming an ophthalmic nurse, a surgical nurse, because of Orbis. So obviously the plane is part of our portfolio, but it's such an incredible advocate. It's an envoy. It's such an inspirational classroom. And we've had presidents of countries come on board and sign memorandums of understanding to start the first eye bank in the country for corneal transplants. So for me, I think the thing I love about Orbis is the team. We have people from all walks of life. So on the Orbis plane, we have about 20 people. We have over a dozen countries. All 6 continents are represented. And we have volunteers from 32 countries. So we have about 400 volunteers from every single country you could imagine. So for me, it's really the Flying United Nations. And we take that classroom around the world, but we also take it into the digital space on Cybersite, cybersight.org, which is now has over 100,000 registered users. We're in every country in the world except for North Korea and Western Sahara. So I'm really impressed when we give a lecture like we did the other day. We had 106 countries watching and interacting live with the speaker. I don't know too many things or places where that happens, and certainly not for free.
Yeah. And so, because you mentioned Orbis has been around for 20 years, and you trained so many people already in many different countries. And at some point, do you think that's like, well, your job is done because all the countries are trained?
Well, a few things. Cybersight is over 20 years old. The plane took off in 1982. So we actually have been around for over 40 years. I think that the challenges are obviously the diseases like diabetes or macular degeneration. The good news is I go to so many countries now and they have excellent cataract surgeons. But now moving it from cataracts to pediatric cataracts or from cataracts to retina, certainly my job is to put myself out of work. I would love to be on an overwater villa in Bora Bora for the next decade. But, the good news is that we have made huge impacts in public eye health, but there's still a lot of work that remains. And part of that work is certainly never going to be done by my hands. I can't treat millions of people who have cataract blindness, but by training an army, empowering a community, that's how we're going to win this war.
When you're telling me all about what Orbis has been doing, it kind of make me think about the healthcare in the United States. And it's kind of in a way similar. In the US, the major metropolitan area with the University Medical Center, you have all the skill set and everything. But again, there's a lot of area that is kind of can benefit from Orbis, kind of like module, and train the community to help the doctor identify things.
I could agree with you more. And while it was never our intention, when we built Cybersight, the online distance learning and telemedicine platform, we still have medical residents and med students going to Cybersight, even though they're at some of the best eye centers and the best med centers like UCSF. And so one of the things I will tell you is I've always been blown away where someone comes up to me at a conference and says, I loved your lecture on blah, blah, blah. And I'm like, where do you live? And they're like, oh, I'm in New York City. I'm like, what? But then I have someone say, oh, I'm in rural Montana. I'm the only ophthalmologist for 100 miles. And so I do think ultimately, Orbis is having global impact, and global includes the United States. But our real focus is in low to middle income countries, helping those who need it most, helping that bottom billion, helping those who really do not have the medical centers and the ophthalmologists and the surgery centers like we have here. But education is a global. And, we have speakers, like I said, we have faculty from every continent giving talks and doing telemedicine consults. It's amazing when you watch what's happening on Cybersight, how people are helping people in the U.S. and the people in the U.S. are helping people in another country. I mean, it's exciting to see how connected we've made the world through aviation, but also now online.
Mhm. Yeah, I'm glad I got to see it in my lifetime.
Yeah. And excuse the pun that you got to see it. I think one of the things every day you wake up, you take your vision for granted, right? There's just no way I'd ever wake up without vision, but that happens every single day. And one of the things, we have a really strong communications team. And, one of the things for every Fly in a Hospital program we do public service announcements. And there are communities where it's considered normal or part of aging to go blind. Going blind is never a normal process. And that's something where we actually teach people that as they lose their vision or as they're having visual problems, to seek eye care early and help that community mobilization so that you're catching diabetes early, catching cataracts early, et cetera. But I'm always amazed at how many people thought it was normal to go blind. And we see grandparents who've never seen their grandchildren because they just thought, hey, I'm now over 60, I shouldn't be able to see. And now, you literally do a 5 or 10-minute cataract procedure and they're seeing their grandchildren for the first time. It's incredible.
Yeah. I mean, I grew up in Indonesia, so I'm sure that you've been to Indonesia.
Yes.
And I remember the cataract surgery they know how to do it very well. And
Absolutely.
we said that probably they know it better than some other developed country because they've done it so many times.
And very hard cataracts, because some of these, obviously, Indonesia is a very challenging place because there are islands, there's metro, there's rural, there's different communities. And so that's where our telemedicine, Indonesia is one of our stronger partners in telemedicine because, just like the Philippines, you have in the Philippines literally thousands of islands. And the beautiful thing that's getting super exciting, I'm hoping one of your listeners who's a lot smarter than I am is going to be able to figure out how to make these portable cameras even, cheaper, faster, more available, where someone could use their cell phone, take a selfie, so to speak, and do retina and eye exams and use our Orbis's CyberSight artificial intelligence and turn their phone over 30 seconds later and be given a diagnosis. I don't think we're too far off from that. But to your point about Southeast Asia or especially island countries, telemedicine is going to be where it's at. And you can't fly the one amazing cataract surgeon to 20 islands in a day.
And the flights are not that reliable too.
Well, yes. And also just practically, right? I mean, you want that doctor operating from 6 a.m. to 6 p.m. You don't want them dealing, with 4 hours in an airport and then going to So I think to your point, certainly as you turn on the news these days, you can get very depressed or very frustrated. I actually think there's never been a better time to be alive. And certainly there's never been a better time to be a medical student or an ophthalmologist. And I know we were talking before, but, to me, the powers that what you have in your fingertips, in your hand with the iPhone or whatever phone you have every piece of information that's ever been created by human history. And it's in your hand. Now, imagine if we could leverage that where not only is it able to give information like the CyberSight library, what if you're able to take that camera and do imaging in the back of the eye and have artificial intelligence? And what's super exciting, and I know you all at UCSF are always at the bleeding edge of innovation, and you're now able to look at someone's retina. And because the retina is actually brain tissue and the only vascular bed that you can look at non-invasively, you can now predict heart attack, stroke, Alzheimer's. So the eye is not just the window to the soul, it's the window to your full body exam. And I don't think we're too far off where in 5 or 10 years, you're going to go to your ophthalmologist and they're going to tell you more about your heart than your cardiologist. And I'm going to take I'm going to love that because my dad's a cardiologist and I'm going to be able to tell him to put his stethoscope away and just come to the eye doctor and put cardiologists out of business.
I did not know there's that competition there.
Oh, there's always competition amongst the subspecialties, especially, my dad told me the purpose of the retina was to be perfused by the heart, right? So yes, no, I would say to me, what's exciting is CyberSight. There's a disease in the back of the eye called retinoblastoma. It's one of my least favorite diseases. It's a cancer. It's genetic. So the parents have guilt about transmitting it to their children. The children sometimes lose their vision and it's next to the brain and can metastasize or grow into brain tissue and kill the child very quickly. We've now managed over 1,000 children around the world with this pretty rare solid tumor in children with St. Jude's Hospital's Toronto Sick Kids. To me, these are children and practitioners who had no mentorship, no hope. And now they're getting the same care as someone at St. Jude's or Toronto Sick Kids. These things, would have been mind-blowing to me when I graduated my residency in 2005, and now I do it every single day at Orbis. It's crazy, but crazy in the best way possible.
And I think I like what you're saying is that when you look at the news, things seems to be so grim because news like to show what's not working. But like you're saying, it's kind of one of the best time to live.
I truly did not think we'd be doing gene therapy in my career.
Yeah.
And now children are, getting their vision restored. And ophthalmology is leading a lot of this because we were the first field to do gene therapy. With artificial intelligence, I would have never thought when I was sitting there doing hundreds of cases in, the county hospital in my residency, that there would be a camera and an algorithm that can see things I can't see. That AI can look at the retina and determine if it's a male or female. It can look at risk factors for stroke and heart attack. I can't do that. I can look at the retina and tell a lot about a patient, their blood pressure, hypertension, things like, but I can't sit there and prognosticate vascular risk and dementia or Alzheimer's. I mean, it's incredible.
Yeah, I think maybe nature give us eyes for different reason too, not just to see.
Oh, absolutely. Yeah. And I will say it's such a precious gift. I mean, you give someone their sight back and you've just changed their family, their world. Yeah, it's a very powerful thing to be part of. And I'm grateful I know Thanksgiving's coming up, and I'm thankful every single day that, I have my sight. My grandfather, my dad's father, was legally blind for almost the entire time I knew him. He never really saw me with 20/20 vision. And, my dad has had retinal detachments, which are very scary. And I think that's when the cardiologist knew the power of an ophthalmologist, is when they fixed his retina. But I would say that every single day I wake up and I'm thankful that I have my vision, I have my health. I get to see my family. I get to wake up. I was just in Zambia last week, and I got to see the fruits of our hard labor, where we work with a very special foundation. And we have transformed that ophthalmic community and have doubled the number of ophthalmologists in 5 years. I mean, we're doing stuff that I never dreamed of, right? I always tell people I'm living the dream I never dreamed of. And I can't wait to see what I'm doing in 5 years, because some smarty pants who's listening or at UCSF is going to find out an app or a camera or an algorithm that I can't even conceive of. And the thing I love about Orbis is I work with the smartest people in the world, but I'm the idiot who gets on the plane and takes it to the most rural place and gets it applied to the communities that need it most. That's my superpower. I am not the smartest person. I'm not the best researcher, but I'll go anywhere and do anything to help those communities.
One of the things that, you've been doing this for a while, and you've seen so many. What are the 3 stories that stuck in your mind that you feel like, wow?
Yeah, I think, for me, one of my favorite stories is the person who had forgotten what his wife looked like. And he had not left the home. He was basically a prisoner in his own house. And it was so funny. I was about to take off the patch, and he asked everyone to leave the room. And anyone who takes care of patients knows when the patient asks for someone to clear the room, usually it's not a good thing.
Why is that?
Because usually they're going to tell you a big bomb, like, they're going to tell a family, they're going to say something like, I had an affair, or this child's adopted, or, I have a drug history. Usually when a family member says, can everyone leave the room, they're about to tell you a story or a secret that they don't want people to know. And so the man, I was about to take off his patch, and he goes, could you ask everyone to leave? And I said, well, sure. But I was expecting something like, oh God, here's something bad. And he goes, Dr. Hunter, I forgot what my wife looked like. Can you please tell me? And because, sometimes we have multiple people in the room, there might be other patients. And I had to describe his wife, and he goes, is she still beautiful? And I said, sir, she's been taking care of you for over a decade. She's one of the most beautiful people I've met. And when I say he ugly cried, as soon as he saw his wife, he hugged her, and he started crying, snot started coming out of his nose. I mean, he was doing something like out of a romantic comedy where they just couldn't stop crying, and they hugged each other. And finally I said, sir, you're crying so much you may hurt your surgery. In a second, he stopped, sat in his chair, and sat straight up. So I will tell you, the first time I reunited a couple, and he had forgotten you think about it, right? Because you just take so many things for granted. I mean, reconnect. I mean, this literally this happens on every Orbis program. We reconnect a grandparent to a grandchild, and they had never seen that grandchild. And you see them with a coloring book, and the grandchild's in their lap, and they're coloring a Disney book. I mean, that doesn't get old. And then I think maybe the last story that I love is that, you know, that cancer I told you about, retinoblastoma. You know, this is the disease I hate most because, you know, I have to tell a family, your child has cancer, they're likely to go blind, and I need to examine all the other children because it's genetic and other siblings may have it. And there was one very, very complicated case in Mongolia. Long story long, the kid got a surgical cure. And just by chance, I was there for another purpose. I wasn't even there for retinoblastoma. And they said, "Oh, Dr. Hunter, this family wants to thank you." And the mother started hugging me. And I'm talking, Mongolians are known for wrestling. I don't know if you know this, but some of the top sumo wrestlers in the world are Mongolians. Well, this woman could beat me at wrestling, and she was crushing my ribs. And she goes, "You're the one who saved my child's life." And I'm like, I'm sorry. And I didn't, you know, and it turns out this was the child that I didn't do a daggone thing. I just was the one who set up the CyberSite account. But when someone thanks you out of the blue for saving their child's life, I mean, that doesn't get old, right? And of course, I immediately called the professor, who's this very smart guy who's done 3 fellowships at St. Jude at Hamilton Eye Center in Memphis. And I'm like, "Hey, Matt, I just took all the credit for your hard work." And of course, I bought him a dinner at the last conference. But yeah, I would say, you know, at the end of the day, you go into healthcare for patients, but how you help them can be very different. For some people, their gifts are research, and they're going to find the gene or the antibiotic or the drug. Some people, their gifts are their hands. You know, I got to meet and work with the doctor who holds the most, he has the world record for the most cataracts in one day. How many cataract surgeries do you think he did in one day? Just throw out a crazy number of surgeries he did in one day.
40?
232.
232.
When you watch him operate, you realize it's kind of like when you watch Tiger Woods back in his prime swing a golf club. He was put on this earth to do that one thing. And so, you know, I get to work with these amazing professors, people who invented gene therapy, invented the artificial intelligence, and I get to sit down and have 3-hour dinners with them and ask them everything from how did you raise successful and healthy, happy kids to how did you come across the cure for the gene therapy, right? And it's always a funny story. I mean, I think why your job is in you know, why being at UCSF and all these places, when you just get to sit and talk with smart people every day, I mean, it's such a gift, right? And I never want to be the smartest person in the room because then I'm not learning. Well, I can assure you at Orbis, I'm never the smartest person in the room, ever, unless I'm by myself. And I am always learning from the mechanics, the pilots. And we built a lot in surgical simulation. And, you know, I would tell you medicine is 30 years behind aviation in surgical training, or excuse me, simulation training, adult learning. And so I sit with pilots sometimes, and I don't talk about planes. I talk about simulators. How did you train this? How do you build that cockpit or crew culture? How do you build a successful team? And I will tell you, FedEx, even UCSF or any of the fancy med schools could learn a ton by spending a week at FedEx and watching how they have basically standardized training and perfected adult learning, team training, corporate culture. I'm always blown away by aviation. So even if I got perfect at ophthalmology, I would still have a lifetime of learning just sitting down and having dinner with the pilots.
And so you spent a lot of time with the pilot through your work. What are the things that you learn from them that you transfer that to your day-to-day work?
Now, I'm going to deny this because if any of them listen, I always give the pilots a hard time and I say that doctors are better than pilots. But the first thing I would tell you that I love about pilots are checklists. And I know Atul Gawande had the checklist manifesto. I love the fact that there's the challenge response system. And it is not a conflict, it is a duty that the co-pilot says wings, check, wheels, check, fuel, check. And we've actually adopted that at Orbis where the nurse challenges the surgeon and says, this is Mrs. Jones, check. We're doing the right eye, check. We're doing a 21 diopter lens, which is the lens that we do during cataract surgery, check. And I can tell you in a lot of cultures, it's unheard of that a nurse would challenge the surgeon, especially in front of a group. And that's exactly what you need, is to break down those silos. And if anyone sees a problem, you report it or initiate that inquiry early. So I would say pilots are brilliant at checklists. They're brilliant at standardization. I really love how they adopt simulation, where literally surgeons will not go into the operating room where they see one, do one, teach one. I mean, that was basically the motto when I was doing my residency. Well, literally, these pilots are doing thousands of simulation, not just how to take off on a bright sunny day. How do you deal with a bird strike, which is, what happened with, the Miracle on the Hudson, or how do you deal with lightning strikes? So they've done almost every scenario that you may never even see in your entire career, and they've done it in their first year of training. So yeah, I would say the brilliant thing that we've done very well at Orbis is osmose the best practices in aviation. Now, again, I hope you delete everything I just said so none of the FedEx pilots give me a hard time next time we have dinner. But I will say I strongly encourage the listeners, especially those who are healthcare practitioners, to think about, how are you having checklists? How are you doing challenge response where someone's checking you before you start a procedure? How are you building simulation into your residency programs? I loved what one of my piano teacher taught me before she fired me. That's a whole other story. Practice doesn't make perfect. Perfect practice makes perfect. And one of the things I would say is it's got to be deliberate and monitored practice. Well, everyone's so busy these days that it's hard for us to get the mentorship in wet labs and sim labs. These machines are getting so smart that they're able to detect micro tremors that a human mentor cannot see. So I do think, again, as I go back to technology and Orbis, we are adopting those technologies as force multipliers for either patient care or surgical training.
And now, you mentioned that Orbis adopting all this technology. What are the technology that you feel like, I wish I have those besides your iPhone that you're telling me about?
Yeah, so I would tell you the things that, especially if there's any of the listeners who are doing in big tech, I do think we'll have global internet sooner than later, for better or for worse. That is one of the challenges, where sometimes a doctor is in very rural settings, or a nurse, and they don't have access to a human mentor. I do think cameras and getting visualization to an art is going to be the big breakthrough. When someone really, really smart is able to find a little adapter that you put on the back of your iPhone, and all of a sudden it can take pictures of the retina, that's a game changer, period. I would say the technologies in training, working on the simulation platforms that we have, that's huge. I think the classroom that we've created on CyberSite is amazing. We have every month about 4,000 courses being taken. Just getting that distributed, getting that translated. I think translation in different languages is going to be very important. And that's getting automated faster and faster with AI and different things. So again, obviously with any technology, there's risk and benefit. There's blessings and curse. I always try to figure out, how can we use these technologies for good? I would say global internet, cheap, readily available retina cameras, and learning tools or devices are going to be three things that we at Orbis are going to be heavily investing in.
Mm-hmm. And so when you say you're investing, how do you work with a for-profit technology company?
So I always look first at their talent. And so, for example, one of our donors, our corporate sponsors, is named Alcon. They're an eye care company. They're incredible. They have biomedical engineers who've been doing their job for 30 years. They're some of our best trainers in engineering. So we have volunteer faculty from industry. Sometimes it's their devices or their drugs. Like I said, the trachoma, the infectious cause of blindness, Pfizer every year gives us over $200 million worth of that antibiotic to get rid of that. So maybe they're donating their talent, their time, or maybe they're donating their products. I think that's where, with industry and tech, I would love for someone who's brilliant to be thinking of the bottom billion when they build their next app, their next device. How can I make this the most expensive thing on the planet and help the richest people in San Francisco or Silicon Valley? How can I make this so beautiful and elegant that it can get into the hands of someone who's visually impaired in the slums of India? That, to me, if someone in the tech space listening could be inspired to not make the most expensive watch in the world, but to find a watch that would allow the entire world to know what time it is. And I have seen that. I mean, I never thought when I left my host family in Kenya when I was 19 that we would be WhatsApping each other or texting each other or sending photos and digital imaging. I will say what people have done with mobile technology, over 95% of Kenya now has a mobile phone. More people have access to the internet than clean water. Those are huge successes that I never thought. I remember when I first saw a car phone, like one of the first bag phones, I was like, oh man, only the richest people on earth are going to have that. Now everyone's got one. I go to certain countries and they've got way better, more recent iPhone editions than I have. So I think the reason I say all this is I would love for your community, especially in, at UCSF in the Bay Area and Silicon Valley, when you're designing things, think of making them simple, universal, and being able to reach the people that need it most. Someone at UCSF doesn't need the fanciest, one of the things I always tell people, so many of the devices we make are for surgeons who don't need them. Some of these very expensive doodads are only in the hands of people at UCSF. I want someone that makes a microscope that can help the doctor who's struggling to have consistent electricity in Ethiopia. That's what I want, and that's what I dream of. And again, the UCSF eye department, they have an amazing Proctor Foundation. They do a lot in global ophthalmology. So I in no way am saying something, I'm just encouraging or inspiring the innovators and the entrepreneurs listening. Solve a problem that's really affecting the whole world and really hurting those who need it most. Finding a way to make your Porsche go faster is great, but just helping someone get a pair of glasses or be able to access cataract surgery. To me, cataract surgery is the most vulgar anachronism in all of medicine. We have the cure. It's less than $100. It takes less than 5 minutes. So, we're not investing in trying to find the cure for cancer. The cure is here. We know how to do this. This is not a new thing. The fact that we're still talking about cataract blindness 20 years later is super frustrating for me.
No, but I'm sure you're keeping making good progress in this space. And thank you for sharing your story. You definitely have a really fun, exciting job. Make me feel like I want to hang out with you for a day to see your day-to-day like.
Come to an Orbis program, and I can tell you the plane will blow your mind. But going to rural Ethiopia and seeing the incredible work that our country team does there in Trachoma, that is so important.
I might take up on your offer there.
Well, you have this is recorded, so you can take me up on it anytime.
Okay, that sounds good. Well, thank you for your time. Thank you for tuning into today's episode of the Health Technology Podcast. We hope you found the conversation insightful and inspiring. If you enjoyed this episode, please take a moment to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps us continue bringing you the latest in health innovation. Stay connected with us on LinkedIn and Twitter for updates on upcoming episodes and more. Until next time, keep pushing the boundaries of what's possible in healthcare. I'm Christine Minato, and thank you for listening.